The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Welcome to Ageless Health with yours truly, Dr. Tom Roselle Live, as you do every week. We got a great program for you, kind of a continuation of some of that, I don't feel my legs, my feet, and so forth. We're going to be talking about diabetic neuropathy from a different platform. And the platform that I want you to understand is that you don't have to have full-blown diabetes to have diabetic neuropathic pain, deterioration, destruction, and so forth. And we're going to get into that in depth over the course of the program today. So pay attention. If you got to that place where your feet don't feel like your feet anymore and you're really struggling, this is something that you really need to pay attention to, because if you catch it on time, it's not only manageable, but it's very reversible. So let's get into that. So the whole process is this. Do you have to have full-blown diabetes to have diabetic nerve damage, deterioration, and so forth? And the short answer, and backed up by the Mayo Clinic and other folks like that, is no, you don't. But you can have all these problems because each tissue has a threshold when it comes to blood sugar. So, for example, if you get type 3 diabetes, everybody's heard of type 1, type 2 diabetes. Guess which system is then being affected? It's called your brain. And we start noticing things like cognitive decline and Alzheimer's problems and so forth. So we really want to understand what is really going on. So let's start with, nope, you don't have to have diabetes to have and develop diabetic neuropathic problems. There's all kinds of things that are taking place, and that's what I want to discuss with you today. I want you to understand that you got to get attention going in the right direction. How many of you, let's start with this. How many of you go to your docs and they do your blood work and they do just a serum glucose? What does that mean? That means the amount of sugar that's in your blood at that moment in time when you had your blood draw. And sometimes it's very normal, and sometimes your doc says, oh my gosh, we have a problem. So the problem is, from my point of view, from a functional medicine point of view, is I want to know the process of development and the things that are going on. That means this. I need to know what's happening with the liver. I need to know what's happening with the pancreas. I need to know what's happening with blood sugar transport in the system. And there's very specific tests, but I want to see them all together, because even though that none of them may be outside what the accepted medical parameters are, the shift, if you will, in a non-productive way, that means is they're going up and they shouldn't be going up, can cause a problem. So what do we want to look for? When you go see your doctor, they need to be running as a baseline, in my opinion, based on all the things that we've done over a period of many, many years. They need to be looking at, one, blood sugar level. You're just, whatever that is, that happens to be a moment of time. That's what you're doing the last 3-4 days, and it's going to drop, or it's going to bring that thing up, or it's going to bring it down. Now, you can have a very normalized blood sugar glucose problem, and when I said problem, it's mean that your blood sugar is normal, but there's other markers that are not. What else do I want to know? I want to know your A1C hemoglobin. So the letter A, 1C, small c, and HB standing for hemoglobin. What does that tell me? That tells me the average of blood sugar in your red blood cell over 3 months. Average over 3 months. So you can fake it in what happens today because you decide to be really good the last 24, 48 hours, but you can't fake that marker. So that's 2 markers that we want to have. The next marker is something called LDH. It's a liver enzyme, but what it shows is tissue damage. So as your blood sugars get to a place where they're penetrating different cellular substances at too high of a rate, or they're sitting outside and they're causing oxidation, deterioration, that LDH level will begin to go up because it shows tissue damage. Now, LDH is a predictor for all kinds of things. By the way, if you're on chemotherapy, God forbid, I hope you're not. If you're doing all kinds of autoimmune drugs and so forth, I hope you're not. If you happen to have, back in the day, you had a lot of the vaccines and so forth, and it was going to destroy tissue. That LDH, that liver enzyme, the one that they rarely run, it just as a course of, we're going to do a general test, and I think it should be run on everybody, is starting to move up. So you have those pieces, you got those three have to be run. You want glucose, you want A1C, you want LDH level. And then the next one is you want to see what your insulin levels are. So you start putting those things together. Is the body working too hard? Is it saying, oh my God, we have all this blood sugar in there? In the initial stages, insulin starts ramping up because it's doing everything it can to transport it in. Next step, we're going to start doing some other patterns. But let's talk about this non-diabetic cause of what you call diabetic neuropathy, right? So we can have things like autoimmune conditions that are causing inflammatory reactions. So whatever blood sugar is there is not being moved, acted upon the way it's supposed to. We know that there are many types of neuropathic problems. We can call central neuropathy, peripheral means distal. Autonomic neuropathy means things that affect the feet, the hands, numbness, tingling, pain, so forth and so on. That's part of this whole thing. So the takeaway, you can have a diabetic type of neuropathy without having full-blown diabetes. Did you hear me? You can have a diabetic type of neuropathy without having full-blown diabetes. So let's get into it a little bit deeper. And, you need to really understand this because I want you to get it together. By the way, I want to invite you on the 20th of this month at the Roselle Center in Fairfax. I'm going to be presenting with Dr. Jerry Cowart. We're going to be talking about all kinds of neuropathic pain. We're going to be talking about your feet and your hands, central neuropathy, and how it affects organ systems. Because remember, the nerves go every place. It's not just your hands and your feet and so forth. So we want to make sure that you can do something about it. I'm going to give you some things today that you can, if you will, do. It's important that you take action now, unless you want to lose your limbs, unless you want your organ system shut down, unless you want to go into a dementia state, unless you don't want your heart to work. I don't know about you, but all those things aren't very appealing to me. So let's figure out what we can do, but we have to understand the process. So diabetes, as it relates to neuropathy, happens when you experience nerve damage. Could you hear me? Diabetic neuropathy is there as long as you have nerve damage, and it's due to high blood sugars called hyperglycemia. Now, it can last a long time before you start noticing the symptoms because as human beings, we kind of set it aside. We don't like saying, oh, I may have this problem. We put our head in the sand, right? So it can affect people with, all kinds of blatant diabetic patterns, type 1 diabetes, type 2 diabetes, but we also talked about a moment ago, type 3 diabetes. So if we have all these things, plus the diabetic patterns that are not detectable early on unless you run something like LDH, and because you could have tissue that's being irritated because the blood sugar is not getting into it, not being transported. Now, this is not just me, Dr. Tom, saying after almost 5 decades of clinical practice and the things that we've seen, but the diabetic-related neuropathy can damage all kinds of things in the body. So we talked about peripheral. Now, that simply means that the nerves that go down your arms, your legs, your hands, your feet, and stuff like that. But there's also the autonomic, the automatic, if you will, neuropathic problems. Those are things that control your involuntary body processes. What do I mean by that? When I talk about involuntary, did you know your blood pressure can be a result of neuropathic pain, neuropathic deterioration? 100%, my friends. So things control other things in the body. We're talking about something that your nerves control your bladder, You can have irritable bladder. You got to go all the time. You can't hold your urine. That can be due to blood sugar transport problems. Your blood pressure goes up. Your heart starts skipping around. Your organ systems that you affectionately like to use when you were very young, called your sex organs, right? They're not working the way they're supposed to. And there's, if you look up, and those of you who like to do the research, go into the your computer, your AI, and look up dysautonomia. And it talks about these autonomic neuropathic presentations. So we want to see what happens. Now, remember, we're talking about subtle shifts and changes and blood sugar levels. But by just doing a blood glucose level, just by doing an A1C hemoglobin, your doctor says, oh, you're at 6, you're in a pre-diabetic state. Not necessarily so. If that persists a long period of time, and your LDH starts creeping up, that says you've got tissue damage someplace in your body. And that numbness, that tingling that you have in your feet may be due just to that. So if it's the case, don't you want to know something about what you can do about it? Well, we're going to talk about that today. So stay with me. I'm going to give you some directions that you need to take action on. It's important. It's truly important that you understand what the deal is here. Look, your symptoms will be dependent on the type of subtle diabetic neuropathic changes that you start seeing. And remember, I said it doesn't have to be blatant. It could just be that, let's watch it. That's what your doctor says. Let's watch it, right? So you can have things like numbness and pins and needles feeling. That's paresthesia, essentially what it's called. You can have pain, and pain could be burning. It could be stabbing. It could be knife-like. You can have muscle weakness. What does that got to do with it? Why do I have a problem with diabetes or neuropathy if my muscles are weak? Well, guess what? The nerves go to your muscles, right? So if they're not signaling the way they're supposed to signal, then the muscles can't function at the levels that they're supposed to function. How about those sores, those ulcers that you have on your feet? And you say, well, my doctor said I didn't have, any kind of blood sugar problem. I'm not diabetic. Well, really? Did he run LDH? Did he tell you that your A1C at about, 6.1 was, you're in the pre-diabetic pattern, but as long as you don't get to 6.5, 6.6, you're okay? Not so, my friends. Did you check out your insulin level? Did you check out your cortisol spikes that cause high levels of inflammatory reactions? So there's multiple pieces that you have to be aware of. And by the way, on the 20th, when you come join us, Dr. Jerry Coward and I'm going to actually show you some of the things that we do to treat. I'm going to take them out. I'm going to show it to you. I'll point out to you this. Some of you have system presentation that everybody's ignoring. Well, after we are done on the 20th, I promise you're not going to be able to ignore them anymore. So go online, register like right now while you're sitting here listening to me. Go to drtomroselle.com, drtomroselle.com, or go to rosellecare.com and go down, find the icon, click it, or you can do it online right now. You can take a picture of what you're seeing and, do it and be there. And like I said, the only time that we, want you to say, hey, is if you can't make it afterwards, right? Because we want to make room for everybody else. Let's talk about other processes that are affected when you have this subtle neuropathic piece, right? You can have digestive problems. You can have heartburn. You can have nausea. You can have, even to the point where it'll start causing you vomiting, a lot of bloating, a lot of diarrhea, gastroparesis, which is a difficult time of digestive emptying. That's a neuropathic problem. You can have urinary problems. We talk about ED, ejaculation, guys, those kind of things. It can be a result of a neuropathic problem that can be very much finger pointing towards blood sugar transport, and it can be very subtle. The only way that you're going to know if it's there, the only way you're going to know if it's beginning to build up, you have to run all of those tests. You've got to run what? You've got to run blood sugar levels. That's right now, that tells you what you've been doing the last 34 or 48 hours. You have to run A1C hemoglobin. That's the average of 3 months in the red blood cell. Really important, really critical. You have to run LDH. That's the liver enzyme that I told you that shows tissue damage. You have to run what? You have to run insulin levels. You have to run what else? You got to find out what your cortisol levels are. All of those things give you a picture that's far more complete than just monitoring your blood sugar. A lot of you are running around with those little tags on your shoulders right now and monitoring your watch or your cell phone or whatever, and it's going off when your blood sugar spikes. Well, that's cool, but unless you know what the average is and it continues to be that way, then you can't draw any continual correlations. You should be eating what? You should be eating lots of protein, lots of vegetables, staying away from the fast-acting carbohydrates. Keep that garbage out of your system. We want to know what your blood pressures are doing. Irregular heart rate's still there for you. Dizziness still there for you. Sweat glands, all of a sudden you've got excessive sweating. Or guess what? You don't sweat at all. Those are all blood sugar transport problems. And your doctor said, no, there's nothing wrong with you. So there's an autonomic neuropathy that is correlated with something called low blood sugar. That's hypoglycemia. And this means that you don't experience the typical warning signs that, like the shakiness, the confusion, the intense hunger, the brain dead, the hangry feeling that you have. You can't function. But all of those are preliminaries that can lead into a full-blown diabetic pattern. And all it takes is a subtle shock, whether it's physical injury, whether it's an emotional injury, or it's another biochemical something, and bang, you got a problem. So the symptoms, if you will, of blood sugar transport problems in the body can be a sudden severe pain in your hip or your butt end or your thigh. Did you hear me? Symptoms of that type of problem can be pain. And it has to do with certain muscle patterns and so forth. I'm going to give you one. We talked a little bit about that liver enzyme, a little sidebar. If you find yourself that you've been on medications, you're taking certain things, God forbid you're under chemotherapy, and your liver has to filter all these things out, right? Or your blood sugars spike up and down like a yo-yo. So if they don't catch it in the right moment, they're not going to see it. But if you find yourself getting angry, you want to bite somebody's head off, you just want to chew it out and spit it up, you're like that, you're just reactive constantly, that's a sign of liver function problems. And you better start running all the tests that we just talked about. Because ultimately, that liver, remember, there's only three things in my world that cause anything. One is injury to the body, subtle or significant. The other one is biochemical, bioelectrical. That's one of the things we're talking about right now, all the things that come into your body from the outside in, called exogenous. And then the third is the decision-making process of the mind. So, the old story, if you think you can, and you will. If you think you can't, you won't even try. Look, we're going to get into the program today. If you stick with me, I'm going to give you things that you can do to help yourself and resolve this thing. And the things that you have to demand that your doctor does to really diagnose what might be leading into a disastrous situation. We're coming up to a break within just a minute or so here. And understand, your body's forgiving. You can turn virtually anything around and make it happen. Everybody's different, but I'm going to give you the differences today, and then we'll explain them to you on the 20th. Look, here's the deal. If you knew you could, if you could turn things around, if you could make a difference, if you knew that sometimes the parameters that you were being told was normal, but you're still having problems, wouldn't you want to know how to handle them? I don't know about you, but when you have a study that says that 15 to 50% of the people, and this was years ago, had type 2 diabetes. I don't know. Let's kind of get it done. Let's figure out what we can do about it. We want to reverse this thing. We want to change it. We want your health back. We want your body to work. We want you to feel your fingers and your toes and your hands. And often it's nothing more than your blood sugar making things far worse than it should be. You're listening to Dr. Tom Roselle. This is Ageless Health. We'll be back in just a very couple minutes, not even less than that. We'll be right back. Don't go away. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey everybody, welcome back. This is Dr. Tom Roselle. You're listening to Ageless Health with yours truly. And we're going to get into a little deeper into something that is a little bit of a confusing paradigm, if you will. So what am I really talking about? I'm talking about people who have neuropathic pain. That means numbness, deterioration, loss of sensation, unable to walk, pain radiating all the time, burning types of sensation. All of those things can be signs of a diabetic neuropathic problem. All right, that tingling, that pins and needles sensation, that occasional burning or hot spots, numb, if you will, tips of your fingers or numbness in your toes, feeling like your socks are all curled up. Those are all neuropathic problems, but here's the deal. When we talk about peripheral neuropathic pain, peripheral neuropathy just means it's at a distance. It's at the distance of your arms, your fingers, your toes, and so forth. But it doesn't tell you whether it's spinal damage or whether it's something metabolically. And the most common metabolic problem, other than the exposure to heavy metals, and we'll talk about that a little bit in a minute, but it has to do with how your chemistry, and we're talking about blood sugar transport. So the numbness, the increased sensitivity, if you will, to touch, or walking on your feet and your feet are burning like crazy. It's not okay. These are problems. You can't ignore it. Mild balance problems. You just, especially in the dark or if something's uneven, you feel like you don't have the stability that you used to have. But your doctor didn't say anything to you. You checked it out. Hey, am I coming down with, a neuropathic problem? Sometimes the answer is for them, I don't know, right? Maybe not. So you got to be able to determine, how do I know if my legs are suffering from a diabetic neuropathic problem? And we have to make sure that we understand what it really means and how to diagnose it. So that's what we're going to get into a little bit today. We already talked about very specific blood work that will let you know whether or not it's you're on a bad course, or you're ignoring something or whatever. So let's talk a little bit about that. So how do I know if my legs are suffering from diabetic neuropathy? How do I know that imbalance is the problem? But my doctor said I don't have diabetes. So if that's the case, is there a localized problem with blood sugar transport? The short answer, possibly. If you go into the Mayo Clinic, if you go into some of the other research platforms, they're looking at this. But this nagging concern that kind of gets into our minds that we may have a diabetic situation or something that's building. So traditionally, your doc, as we said earlier in the program, is going to look at your total blood sugar. And if you're lucky, they'll do an A1C hemoglobin. But there's other testing that you need to do as well. So what do I have to do? Well, you got to ask them for something called LDH. That's a liver enzyme that shows tissue breakdown. So if you see a borderline blood sugar transport level, meaning let's say that your A1C is at 6, your doc says, no, you're kind of getting into that pre-diabetic state, but it's not a problem. As long as we keep it there, you're okay. It's not an issue. But you start seeing LDH, a liver enzyme, which for whatever reason, they just don't order automatically. We do with all of our patients. And if that thing is starting to go up, that's telling you you've got potentially tissue damage due to blood sugar transport problems of some sort. Now, what else do we have to run? Well, we want the blood sugar level, we want A1C hemoglobin, we want LDH, and then what do we want? We want insulin transport, because if that insulin level is working overtime, it tells you that we got a problem. Then we want to see cortisol. Now, pretty soon that insulin is going to get tired because it becomes resistant. You know that old term, insulin resistant, and it can't do the job the way it's supposed to. And pretty soon it starts crashing. Your blood sugar starts going up. So we have to look very carefully. It's a multifaceted platform. And unfortunately, in traditional medical issues, they only look at one piece. There was a very dear friend of mine, a medical physician who I've worked with for years, and he finally retired. And he said, look, I'm in a profession, unfortunately, that if there's not a drug to fix it, we don't order the tests. So it's up to you. I'm going to tell you how to fix it. And if you join me on the 20th of this month, Dr. Jerry Cowart and I at the Roselle Center for Healing in Fairfax, we're going to present a night on all kinds of neuropathic pain, and I'm going to show you how we fix it. I will show you how we fix it. Now, there's lots of stuff that's happening. We've got something coming up, if I remember very quickly. It's called Blooms and Bowls, and I think that is on the 13th, and this coming week, at the Roselle Center in Fairfax. And our nutrition staff is going to be there. They're going to let you taste different foods and say hello to you and introduce you. So go online, check it out. Go to the Roselle Care, rosellecare.com, rosellecare.com. Check it out. It's an open house. Please come and join us. And, they'll give you a tour. They'll show you what's going on here. But our nutrition department, you can ask them any questions you want. They're going to give you a ton of free data. It's all about making sure that you have all the tools that you need to resolve your health problems and make you better and stronger than you've been in a very, very, very long time. So Blooms and Bowls, May the 13th, is from 12. I think it says 12 to 6. And so it's a walk-in. Just come in anytime you want to in the afternoon. Come in, at lunchtime, middle of the afternoon, on your way home from work, and you'll get to meet some really, really amazing people. We'll have some fun. After, I'll probably be in the back hiding with patients and treating people. But if I get a chance, I'll come up and say, hey, wave to you. But join us. It's our gift to you. We want to introduce you to some really amazing soups. and that are organic and that you can order that give you that little extra support. But join us on that day. Listen, let's get back into the program. So one of the things that we do at the Roselle Center for Diagnostic Imaging is something called thermographic imaging. What that does, it takes a picture of blood flow. And either there's too much blood flow or there's not enough blood flow. And the thermographic imaging has been part of our diagnostic platform for a long time. Dareth Painter, who is the key clinician in thermographic imaging, has been doing this for over 20 years. She's amazing at what she does. And so if we want to take a picture of your feet, of your hands, and see if there's a problem or anywhere in your body, and particularly ladies, by the way, breast thermography is the go-to in Europe, not mammography as it is here. It's not going to take your breast and crunch it with 45 pounds of weight and then radiate it with a CAT scan, basically. No, this takes a picture of your heat imprint, lack of or there. And by the way, breast tumors need to have a circulatory pattern, if you will, before they can develop the tumor. So it shows it up 3 to 8 years. You'd like to know more, go to Thermography Centers of Virginia, thermographycentersofvirginia.com, and check it out. But make an appointment. If you want to find out, you can even come in that way. You don't even have to see any of us. If you want to find out if you got neuropathic problems, make an appointment, call in, get it done. And she'll show it to us and, so forth. And she'll give you the information. She's amazing. And so Thermography Centers of Virginia, make an appointment, make it happen. It's going to show that blood flow that's critical in all these things. Let's get back in and let's talk a little bit more about what we're doing. Sensory changes are what we're talking about when it comes to any kind of neuropathic problem, right? We're talking about pins and needles sensation. We're talking about numbness. We're talking about burning. We're talking about increased sensitivity to touch. It's kind of an interesting term. They call it allodynia. And I'm not sure where they came up with it, but it's called allodynia. And it's paradoxically, while you might have numbness in certain areas, other areas become hypersensitive. And it's like, I can't even begin to touch my skin. And it can happen anywhere. It can happen superficially on the surface of your leg, the back of your calf, on your feet, on your arms, whatever. But it has to be distinguished. It has to be put together relative to, is it neuropathic from the nerve being irritated, injured, or being pressed upon? And we call that spinal nerve entrapment, a subluxation. Or is it metabolic, like we're talking about right now? If you have an autonomic, meaning it's on its own, these autonomic neuropathic problems can cause involuntary body functions to not work the way they're supposed to. And it can be like dry skin, reduced sweating. You don't sweat anymore. And that can be blood sugar transport problem. It can cause your body to be dizzy, lightheaded. You can even faint because of it. That can be blood sugar transport problems. Digestive issues, and that's your stomach, sometimes irritable bowels, sometimes diarrhea, sometimes the other way around. And these automatic functions, now dysfunctional, are associated with blood sugar transport and low levels of diabetes. You can spike up and down into a diabetic condition, and until it gets where it's destroying tissue, which we're going to measure with what? Remember, LDH, we're not going to be able to catch it. And until you have a raging blood sugar level, your doc says, well, you can manage it. Why don't you start out doing this? No, you got to do something quickly. And there's very specific things that you can do to reverse what we're talking about. So if you find that your condition is worsening, and you kind of do a gut check and you say, hey, what's my diet been like over a period of time? Do I sit on my butt all day long and I don't move anywhere? If you're finding yourself very unstable, say, well, I'm getting older. Not necessarily. It just means you've been putting up with a lot of junk for a long period of time. So why don't you face the fact that you may not be taking care of yourself the way that you should be taking care of yourself? Now, if things get progressively worse, there's things that you have to include in your diagnosis. You don't want to jump in them right away, but there's something called a monofilament test. It's a fine, soft fiber differential, if you will. It's used to lightly see if there's any shifts. Slightly, what I mean, light, soft touch. So there's a way of doing it electrically, but the doctor can do it with you. You can take your hand and just lightly touch and compare one side to the other. So you go down one side of your body, go down the other side of your body, the same neurological distribution, and say, do you feel it? Does it feel the same, one side or the other? You can take like what's a pizza cutter, okay? It's called a pinwheel. And you go down and you do the same thing. You track the neurological platform. Does it feel the same, one side to the other? Now, you can do nerve conduction studies. You can do automatic function tests and so forth. Those are when you start getting suspicious that there's something there. There are things that increase your risk, right? If you're too fat, yeah, did I say it? I said it. If you got too much around that midsection, you got to change something, people. You really do. That's one of the primary things that are contributing, to insulin resistance and high levels of inflammation. And they can provoke and bring about and contribute to neuropathy. Smoking. How many of you, went to e-cigarettes and you still smoke, or cigars or whatever? And even, unfortunately, years ago, you could have done some permanent damage if you were a heavy smoker back in the day, but the body will forgive yourself when you stop, and you got to stop right now. So as we get older, you're more susceptible to diabetic challenges because you've been ignoring yourself for such a long time. You haven't been in shape. You're not eating the way you're supposed to. You're not doing the things that you need to get done. You're ignoring the signaling neurologically to the systems that need to optimize your blood sugar transport. Regular blood sugar monitoring is critical. And I don't mean just the day-to-day where you put the patch on your arm and you got it hooked up to your wristwatch and so forth. But those things are important. You have to make sure that you're dropping your inflammatory levels. In our world, we're going to use things like berberine. We're going to bring that level up quite significantly. Berberine will dramatically increase transportation of blood sugar into the tissue where it needs to go. And it also fights and helps prevent certain types of cancers, according to literature. Now, so please make sure you understand that this is not something that you should ignore, not even a little bit. We have to make sure that your nervous system is working. Make sure that you're looking at, tissue changes. Is there any discoloration that's taking place, in tissue? You take a look at your fingers. Are they red or are they pale? You can't get any circulation back into it. You press your nails and it's like nothing's there. You tap like this and it doesn't feel. You go to, button your shirt and you can't feel anything anymore, or not like you used to. So it takes you forever. You're asking somebody, hey, can you button my shirt for me? That's not okay. That's not all right. You go down to tie your shoe, and one, if you got too much around the belly, you can't bend over to do it, but you got to ask somebody else to do it. So you're looking for slip-ons. You're starting to avoid what's really going on, that your blood sugars are starting to climb because you got way too much garbage in your system. Your body fat is skyrocketing, and you're saying, oh, well, that's what happens when you get older. I'm here to tell you that that's not okay. It's not okay. And if you want a life other than sitting in a chair and flicking the remote control and feeling sorry for yourself, taking the 10 different medications that they put you on that's slowly destroying your body and killing you, then, if you're okay with that, go for it. God bless you. You'll have another chance, when you meet your creator and see what he's got to say to you. Look, a lot of questions that need to be asked. How quickly does these subtle changes in diabetic neuropathic presentations progress in the leg, right? So the rate that it progresses can be very different from person to person. There's no fixed timeline. It's not predictable. And why it's not predictable is the thing that you need to understand, is because some of us have stalwart bodies that we do certain things to, and it just kind of schleps it off. But when you have a consistently high or medium high, a pre-diabetic A1C, you might experienced more advanced neuropathy over someone who's had diabetes for the same duration, but maintained excellent blood control through exercise and diet and taking right nutrients. When we get in the last part of the program, if you stay with me, I'm going to tell you some nutrients that you can take that will help you and help you right now. And I want you to do that. I want you to take care of yourself. I want you to know that you're not stuck with anything. Unless you lost a limb and it's gone, you're not stuck. As long as it moves, you're not stuck. So guess what? It's your decision, right? It's your choice. You can either deal with it or you can make life a whole lot better, right? So what are the consequences long term? Yeah, you can lose a leg, you can lose toes, you can lose them one at a time. It can, in the early stages, impacts your sleep. You wake up all the time at night. That is a blood sugar transport problems. You go to bed at nighttime, you wake up in the middle of the night, your blood sugar drops or your cortisol spikes. Now, when your blood sugar drops, it has the same sensitivity impacts as if your blood sugar sometimes gets way too high. And we're going to talk a little bit about that on the 20th. So join me and I'll tie all the pieces together. It'll be very interesting. And by the way, don't forget, coming up, very, very quickly on the 13th, Wednesday night or Wednesday afternoon, open house at the Roselle Center for Healing, 12 to 6. Just pop in, say hello, join us. And we will walk you through a lot of things and just show you what we're very proud of, the place that we help people. But when we come back in the second part of the last part of the program today, we're going to talk about supplements. We're going to talk about a little bit of vitamin B complexes. We're going to talk about something called ALA, and we're going to talk about exercise, and we're going to talk about and how quickly that you can see things change. It's important that you realize that you can change this crazy, right? We have a staff that is amazing in the nutrition department. We have ways with thermographic imaging that you can determine if you got a problem neuropathically. You can make an appointment with them at Thermography Centers of Virginia and make that happen. You can sign up to get some blood work done, all kinds of things. Join us on the 20th, but also join us for the open house because I'd love to see you. I'll pop out. I'll be with patients all day long, but I'll be there and say, hey, and glad to shake your hands. But the 20th, I get to spend a lot of time with you and I'll be able to put it together. We're coming up to break in the program. And I promise you when I come back, we're going to be talking about very specific applications, things that you can do for yourself, things that can make a difference. If you're willing to make some changes, if you're willing to shift, if you're willing to go the distance. I don't know about you, but if it was my body, I'd sure want to get it done, right? I'd want to do it. I don't want to be like that. I want to be as good as I can possibly get. I'm looking at another 30 years plus. Yeah, somebody said, yeah, doc, 30 years? Yeah, maybe more. Who knows? With technology, we might be able to make it longer than that. I could be around to bug you all for decades to come. All right, we're coming up to the break, and don't go away because we're going to get deeply into that nutritional piece. You're listening to Ageless Health with yours truly, Dr. Tom. I'll be right back. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. This is Dr. Tom. You're listening to Ageless Health with yours truly. Great program today, one that should make a lot of you very uncomfortable. And I don't do it on purpose. Well, yeah, probably I do. I want you to take control of your life, your health, and know that you can do something about it. So are you going to do something about it? We're talking about a subtle diabetic neuropathic problem. And first, let's talk about you don't have to have a full-blown diagnosed diabetes from your medical physician to say that you have neuropathy that is due to diabetes. It can be gentle ups and downs in a progressive mean that continues to go upward, but it's there and you can't ignore it. So what can you do? We talked about there's different diagnostics. The diagnostics we talked about are what? We talked about thermographic imaging to see the blood flow. We talked about ordering very specific testing from regular blood sugar levels, A1C hemoglobin. We talked about something called LDH, which is liver enzyme that shows damage to the tissue. We talked about running insulin levels. We talked about cortisol levels and so forth. All of those things are paramount. The other thing you need to run is vitamin D level. Your vitamin D level gets too low. Vitamin D is a hormone, by the way, and it helps perpetuate other things. It's not going to look good. Look, when you come in on the 20th, we're going to talk about everything from heavy metal and how they cause problems with neuropathic deterioration and so forth. But I promise you I was going to give you some things that you could do, right? So when you do these things, I'm not going to give you specific dosages. I'd rather you start at lower levels because you're not my patients. Some of you are. And so, but I'll talk to you privately. So here's the deal. There's something called ALA, alpha lipoic acid. It's an antioxidant. It's found naturally in the body as it's available. And, you can get it in supplementation when you want to bring the levels up, ALA. Now, I told you can get a lot of these things through our website. You can go to rosellecare.com, go to the Ageless Health store, and you go in and order those right off. They're going to ask you for, I think they're going to ask you for your email, and you make up your own password, and these companies are great. They'll send it to you overnight. Vitamin B complex, especially ones that are high in thiamine, B1 and B6, and guess what? B12. So you're going to look at your vitamin B complex, say, well, I'm taking B12. It says cyanocobalamin, right? Well, here's the deal. Cyanocobalamin is not the most effective. Cyanocobalamin, you have methylcobalamin, you have hydroxycobalamin, and you have what? You have tetracobalamin. And they all work different areas. But if you're going to do the number one that's probably the most effective, it's going to be the hydroxy form. So hydroxy B12, you can get it from Biotics Laboratories. You're going to find it online. You take it with a little bit of folate, and matter of fact, their B12 Biotics is combined perfectly with folate. So you can take a couple of those a day, and when you have a potential problem for what we're talking about. B1 thiamine. Biotics also has something called Bio B100. We use a lot of it. And there's another product called B6 phosphate. All of these things work well, and they can help stop the breakdown of diabetic neuropathic problems. So we got two things that you can use right away. Do you know that we use acupuncture on an ongoing basis to decrease the inflammatory levels and managing neuropathic pain? Extremely, extremely, extremely effective. So we want to make sure you understand vitamin D levels. You've got to get them up. Don't let your doctor tell you, well, you're above 30, you're fine. No, you're not. You got to get it up to about 90 and keep it there. So, oh, you're at 90 now, you can stop. No, you keep taking it to keep it at that. I never understood why a physician would tell a patient that, okay, you're there, so we don't have to worry about it anymore. Doesn't make sense to me. So you get it up, you keep taking it. Magnesium is another one. Magnesium malate for blood sugar transport is great. For muscles, magnesium glycinate. There's lots that you can do. And we're going to give you a lot more on the 20th. So make sure that you join us. So vitamin D level. And then acetyl L-carnitine is one that I use a lot of with my patients. It's an amino acid, and it's found in red meat. And it helps your cells use the fat around it for energy. And it plays a huge role in helping reverse a lot of things that we've been talking about today. Wow, I gave you a lot, right? But guess what? Show up on the 20th, and I'll give you a lot more. We're going to get into the depths of the things. I'm going to show you how it's treated in combination with nutrition and so forth. But you can get a lot of the stuff. But it's May the 20th, 6 p.m. at the Roselle Center in Fairfax, Virginia. The weather's great. Join us. And don't forget, on the 13th, we got an open house from 12 o'clock to 6 o'clock. We'll be seeing patients. So there's going to be a lot of people around here. So join us. Come out and say, hey, we got to have nutritionists walking around. They're going to answer your questions. Just ask them anything you want. Ask them, what can I do? And they're going to say, they might get into a little 5-minute presentation for 3 or 4 of you, or 2 of you, or 1 of you. And, listen, I want you well. I want you to be in control of your health. That's why we do this thing. That's why we're here every week. That's why we're giving you the best information you're not going to find anywhere else, because you deserve it. Look, there's so much that you can do. There's so many things you can reverse if you're willing to step up to the plate. You can get rid of the nerve pain. You can get rid of the numbness, the pins and needles. You can get rid of all that nonsense that has been stopping your life if you're willing to do something about it. Do you like living in pain? I don't know about you, but I don't. There's vitamins and minerals and herbs and stuff that I haven't even touched upon. And we're going to get more. But your B complex, your ALA, your berberine, your vitamin D, your magnesium, things like that will make a huge difference. Choline is important because it protects the outer covering of the long nerves of the body. It protects the nerves in your brain cells. Remember we said type 3 diabetes? Yep, it's important. But we want to make sure that you have every opportunity. There are good products out there. Don't go to, unfortunately, Costco. You never know what they're offering you. If you're going to go buy something off the drugstore shelves, you have an opportunity right now to buy from some of the best laboratories. Go to Ageless Health, and on our website at rosellecare.com, rosellecare.com. And, you're going to find that this has a very doable, fixable, reversible platform that if you're willing to get your butt off the sofa, go for a long walk, what do I say? Start at 5 minutes, 5 minutes, walk down the path. Well, I'm on a walker. So you're slow. That's all. You go a little slower. I got a cane. Okay. So go ahead, go do it anyway. Do a little bit, go 3 minutes, 3 minutes one way, 3 minutes the other way. Then next week you go 4 minutes one way, 4 minutes the other way. And you keep going. How much of that ALA should you take? I'll give you a sneak preview. About 600 milligrams minimum a day, working your way up to about 600 milligrams 3 times a day. It will begin to reverse problems. And another sidebar, something that's called Boswellia serrata. and it dramatically drops the inflammatory reactions. We're coming up to the end of the program. Please, please, please join me on the 20th and join us here in-house at our open house on the 13th. Love to have you as a friend and as someone that we can continue helping. You're listening to Ageless Health with yours truly. Remember, I'm here every week for one reason only. I love you all. Have a good day. Bye.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be